Yes, this is long-lasting and late-onset neutropenia are newly detected diseases in which neutropenia is the predominant feature, but not the only one. So these other features are the occurrence of autoimmune phenomena, the tendency of lymphocytes to decrease over time, and a specific characteristic, I would say more than specific, immunophenotype profile with generally normal immunoglobulin level, but tendency to reduce of T regulatory cells, increase to double negative B cells, and to diminishing of T cells and NK cells. So these are characteristic elements not specifically pathognomonic in a disease which differentiates itself from the classical primary immune neutropenia because the patients do not have the epidemiological feature of the classical primary immune neutropenia. Why are these long-lasting late-onset neutropenia different from the classical primary immune neutropenia? They differ because they have the tendency to develop over time of autoimmune phenomena, which is not the case in primary autoimmune neutropenia. They differ because they have a characteristic immunophenotype, which includes a normal level of immunoglobulins, but reduced T and NK cells, reduced Tregs, increased double negative B cells. And the other difference is that these patients have the occurrence of the disease at an age which is not the classical for primary immune neutropenia. So either later, after 5 years of age, or a duration of the disease is longer than the classical 24-36 months typical for the primary immune neutropenia. And so what is important is that if you go in more depth investigating the genetic background of this disease, you find in 10 to 13% of cases pathogenic genes which are involved in the autoimmune diseases, like for instance common variable immunodeficiency, which is a disease that may have a quite changing phenotype. So the point is that we're now facing a newly detected disease which shares some characteristic with the autoimmune disorders and can have on the background in a proportion of patients genetic genes related to immune dysregulation. This is a category disease that may fit into a new provisional entity which has been depicted by the classification of the EHA, unit endocrine action, which is called likely acquired neutropenia. So a neutropenia that can either be acquired, but can also be something that has a genetic background on a history.